My name is Dr. Rona Law, and I am a foot and ankle specialist. From a young age, I loved science. Biology really interested me, loved sports. I injured my ankle quite a few times playing basketball in high school. I found a liking to sports medicine, and on top of that, I loved helping people. I think that's what you hear commonly, but for me, I have a big, strong heart for getting to know people. Everyone has a different story they can bring in, and I really look forward to not just treating the patient as a diagnosis, but as a whole. What I am looking for is anything from a very subtle injury or just acute pain, chronic pain, long-standing foot deformities that have not been addressed. There is absolutely a little bit of taboo when patients have foot and ankle issues. Even doctors themselves get very embarrassed when they have foot and ankle issues and even deformities. It doesn't need to wait until it gets to the point where the patient develops very severe arthritis. It's very important to come in early if they have any kind of issue that can be addressed earlier than it being too late.